probably start joining a little bit slowly since we sent out a new link through the email. So today we're having, our speaker is a zoo veterinarian, Dr. Priya Bapodra, and she's going to be talking about her background and just a few different things that she's dealt with. I believe there was like a CHEETAH like ambassador program and things like that. So that's super exciting. And before we start, I'm just gonna have two quick announcements, just PVMA announcements. So tomorrow is our Halloween social, and it is, it's like there's gonna be a costume contest and a few games and things like that. So if you guys want to get into the Halloween excitement, you can still do that through Zoom with our club. So there's that. And then also we have a volunteering opportunity for Pets for Life, which is a PVMA website. And it's basically, this opportunity is basically just making edits, doing a little bit of research and doing stuff like that. And you get a point for doing that, which if you are trying to be on the exec board the following year, or if you want to stay an active member, then you should be looking for these opportunities to get points. And if you have any questions about it, there's more information in the email, and you can contact Bella at marino.15@osu.edu. All right, so I believe Dr. Bapodra, you should be able to share your screen now.
Can you see that?
No, I don't see that.
1 second. Share screen. It says host is disabled, participant screen sharing.
Okay, could you try now?
Okay, perfect. Can you see that?
Yep.
Okay, perfect. And can you hear me?
Mm-hmm.
Okay, awesome. Okay, thank you guys for inviting me to talk to your pre-vet group. My name's Priya Bapodra Villaverde. I'm a senior veterinarian at the Columbus Zoo and Aquarium. I have been there since 2012, so a fairly decent time. So I was asked to give kind of a background to how I got into this field in zoo medicine, and just some cases from the zoo, which I chose to focus more specifically on kind of our big picture projects as opposed to like individual cases. I'm from the UK, which means we don't typically go into vet school after an undergraduate degree. We go straight into vet school, and we pick our A levels, which we do between the ages of 16 and 18. So basically your kind of high school, I would think. And you know, in high school, I was a complete science geek. I picked biology, chemistry, maths, and then advanced biology, chemistry, maths. So I definitely knew in high school that I wanted to go into a medical type field. I wasn't quite sure which area. So if you guys are interested in vet stuff, you guys have a good leg up since you're already interested in that, or at least going that route. When I started to think about what I wanted to do and applying to university, which again, we go into vet school at the age of 18. So kind of in that 16 to 18 year category, and before I kind of applied to vet schools and figured out what I was going to do, I wanted to get a lot of experience, and that is still something that's very true when applying to vet school in today's world. It's to really highlight and demonstrate your interest in the field, your passion in the field. And one of the ways I was able to demonstrate that is I got a lot of different experiences. So companion animal practice, which is fairly easy to to acquire. Exotic animal practice and zoo medicine was a little bit more difficult. Can you guys hear me? Okay.
Yeah, I can hear you.
Okay, perfect. I could just hear people in the background. I didn't know if you were trying to tell me that you couldn't hear me. So zoo medicine, you know, is a little bit tricky, especially as an undergraduate, especially as a high schooler and when I was getting experience, but I kind of muscled my way into finding a veterinarian that served a local zoo that I was able to spend time with. The biggest ones on here that I think stood out on my application was the fact that I did laboratory experience. I went to a research lab for our local university, and I went to a slaughterhouse. And again, they're both things that you need to at least have experience in, especially even if you don't want to go into those fields. I think it demonstrates your desire to know all about veterinary medicine. And then I did a lot of husbandry placements too, again, just to demonstrate the field of husbandry and making sure that you're aware of what it takes to run a dairy farm and those kinds of things. So I definitely had a broad experience, and I wanted to be sure, you know, this is an expensive degree, it's a long degree, it's a vocational degree. So once you kind of do it, it's kind of hard to turn back, if that makes sense. So I wanted to be sure that everything aligned and I was going to be really comfortable in this field. I was very lucky. In the UK, we are only allowed to apply to we're only allowed to apply to 6 veterinary colleges. And at the time, there were only 6 veterinary colleges that you could apply to. And I was really fortunate that I got 3 offers, and my top was always the Royal Veterinary College at the University of London, just because I've always loved London. I always wanted to live in London. And it was a great program, and it had 2 amazing campuses. So one in downtown central London, which was obviously very fun, and then one in the countryside for the clinical years. So I was there from 2001 to 2006, 5-year degree, loved every minute of it. While I was in vet school in my last year, I was able to pick a month zoo elective. We didn't have in that time the very specific tracking that you guys are offered when you get to vet school, at least at Ohio State University. So I kind of had to make my own find my own path and kind of find people that were interested in supporting me in this industry and in this passion. And I was able to do a 2-week zoo elective, and during that time I got into contact with some people, and I actually did my first ever zoo research project in my final year of vet school. And it was a very simple project, but it allowed me to meet people in the zoo field, learn from a bunch of really smart people, travel to a bunch of zoos, and essentially get my foot in the door. And I was able to present my, tiny little research project at the British and Irish Zoo Association Research Symposium, which was really cool. Once I graduated vet school in 2006, I felt that it was really important, irrespective of which field I wanted to go into eventually, whether it was zoo or farm or whatever, that I really needed good clinical skills. I needed good first opinion clinical skills. I needed good client communication. I needed all of these basic skills so that if your dream passion profession of being a zoo veterinarian fell through, I wasn't going to be homeless and I wasn't going to be jobless, and I knew how to be a veterinarian. And it's actually something that stayed with us, because we, up until very recently at the Columbus Zoo, had domestic animals. We had almost 90 cats and dogs that were part of our Animals on Safari show. So we actually still to this day practice companion animal medicine. So that year and a half that I went into charity practice in the UK was just incredible to get those first opinion skills. And, we talk about rotating small animal internships before you go into zoo residencies. And I really felt strongly that I wanted first opinion practice, again, just because of the client communication being a little bit different than you may get in a university hospital or in a regimented internship. So after I did a year and a half in practice, I decided to continue on my path to get more zoo experience and more conservation experience and really figure out if this was the profession for me and if there were job opportunities for me in this field. So I did a master's in wild animal health in 2007 and 2008. And this was a program that was through the Zoological Society of London and the Royal Veterinary College. It was a combined master's degree. And as part of this degree, not only did we get to talk about conservation and listen to people come and talk to us like David Attenborough and a lot of zoo people, as well as people doing cutting edge conservation science. And just, you know, it just blew my mind. It opened up the world for me in terms of going from just wanting to work in a zoo to really having more of an impact on conservation and in animals in their native range. And it also provided a clinical opportunity to work at both London Zoo and Whipsnade Zoo, which were partnered with the Zoological Society of London. So I got clinical experience as well as didactic teaching, as well as research experience. The coolest thing about the Masters is that it's a very international program. Out of everyone in that team, only 4 of us were actually British. The rest of the crew, the rest of the students were very much international. So we managed to develop a really good network of conservationists, and obviously as an alumni of the organization, we get a lot of cool information from other people's projects and work. And like I said, it was an opportunity to really get clinical experience, and it was the first time that I ever, you know, spayed an iguana, which was really, really cool. As I mentioned, as part of this wild animal health degree, I was able to do a cool research project, and I traveled to Sri Lanka to the Binawala Elephant Orphanage, and I really wanted to look at elephant ocular anatomy. So I've always been interested in elephants. I'm not going to say they're my favorite species, but they're definitely one that I have worked the most with and absolutely love working with. And it was really hard to fathom how you were going to treat an elephant's eye if you weren't even aware of what their anatomy was, because up until 2007, no one had really looked into the anatomy of the Asian elephant eye. So that's what I designed my master's project around. I traveled to Sri Lanka with a very, very expensive but borrowed ultrasound machine, and I ultrasounded the eyes of 60 different elephants at this orphanage, and I really wanted to look at ocular anatomy. So again, it was a very simple project, but it was a very cool project. It allowed me to travel. It allowed me to work with a lot of different people in a lot of different situations, and obviously scan these elephants in, as you can see, very free contact situation in rivers surrounded by a bunch of elephants. And the picture on the right is actually a private elephant owner who allowed us to come to his facility to scan eyes too. So some of the things we looked at was just the overall size of the eye, you know, the cornea on the surface, how thick that was, you know, the size of various segments, the overall dimensions of the lens. So again, just basic anatomy that no one was really familiar with until we were able to do this ultrasound project. So after I did my master's, that was 07 to 08, I was really fortunate that I met my future mentor, Dr. Bob Wolf, at the Zoo Vet conference in Los Angeles, and we got talking, and the next year she offered me the residency program. Again, I was very lucky. Residency programs are definitely something that you have to apply to a lot of programs, but fortunately, Dr. Wolf and I hit it off. I had all of the qualifications that she needed for me, needed me to have, and I packed my bags and traveled to the wilds in southeastern Ohio in 2009 to start a residency in conservation medicine, which at the time was the only residency of its kind. So I'm sure you guys are familiar with the wilds, but it's a 10,000 acre facility with numerous endangered species. And one of the things they really focus on is the breeding and management and the sustainability of a lot of species. So again, it was here, which was my really my first non-domestic animal experience. So even after doing the masters and even after seeing practice, this was the first time that I was a primary veterinarian dealing with a very endangered species. So the first time I was able to do rhino anesthesias, the first time I was doing, cheetah medicine. We worked in a very semi-free ranging situation. So the wilds is not your classic zoological facility. These animals are maintained in large, 200 to 300 acre pasture areas. So what we did was very similar to what you might do in a large range situation. So, we were doing zebra anesthetics in the field. We were doing deer anesthetics for dystocias. It was also the first time I did surgery. Well, not quite the first time I did the one iguana spay, but first time we're doing surgery in these enormous animals in field-like conditions. So it was just an incredible opportunity. So after my residency ended in 2012, we always talk about being at the right place at the right time, and that was certainly the case for me. The Columbus Zoo and Aquarium was opening a new Heart of Africa exhibit. They were bringing on a new staff veterinarian, and they wanted someone with experience in hoof stock, which the wilds is very much known for all of their hoof stock. So I was hired in at the Columbus Zoo and Aquarium. Very different situation compared to the wilds. The zoo currently has over 10,000 animals, over 800 different species, whereas the wilds has around 30 species. 25 of them are endangered. The zoo focuses on obviously not just the management of these animals, but also a huge amount of money goes towards conservation projects over 40 different countries. Two of the missions that we like to go by is to lead and inspire by connecting people and wildlife. And in order to touch the heart, you need to teach the mind, or touch the heart to teach the mind. And what both of these sayings mean is, one of the things that we really focus on at the Columbus Zoo and Aquarium, and one of the things we really pride ourselves on, is being able to have these experiences that can really connect people to animals in no other way. And we feel very strongly that unless you can engage people and unless you can have those in-person real experiences, it's very hard to inspire people to care. It's very hard to inspire people to either donate to conservation projects or think about these animals in a much larger scale other than, oh, here's a giraffe, or here's a cheetah, or here's a sloth. So we very much want these immersive experiences and to demonstrate the natural, the natural adaptations of these animals. And ultimately, not everyone can travel to Africa. No, not everyone can travel to South America, but being able to talk about these animals and talk about some of the issues they face in the native range is very important to us. And so moving on from my background, I just wanted to pick 3 different big picture projects, or I should say big picture zoo things that we're very proud of, or I'm very proud of. I don't want to talk about individual cases because I feel as though that's a little bit pigeonholed, but if you're thinking about zoological medicine as a profession, I thought this would be a little bit more useful. So one of the things that the Columbus Zoo is very much known for is its cheetah ambassador program. So cheetahs have been worked at the zoo since the 1990s. Training really started about 6 or 7 years ago when an animal programs training manager was hired. And our cheetahs have traveled throughout the United States. They are used for education programs both at the zoo. They're used education programs in local zoological, local schools and local facilities. And these cats also travel throughout the United States, either with Jack Hanna for some of his educational activities, but also to support conservation projects that are highlighting cheetahs. And one of the amazing things about having these animals, I'll go back a little bit. One of the amazing things about having these animals so habituated to people is the medical care and being able to utilize this amazing relationship that cheetahs and trainers have. and being able to use it for amazing preventative medicine programs and being able to care for these animals. So this is just an example of how well trained our cheetahs are for injections. I think I'm going to try and turn the sound off. So this is how we currently give our cheetahs their vaccines. Everything is under operant conditioning. It's all voluntary. Their participation is voluntary. So this cheetah could literally get up and walk around this board and it wouldn't have to participate. But they're trained for vaccines, they're trained for blood draws, they're trained for x-rays. And again, from a medical perspective, this is one of the big benefits of having an ambassador program. So I talked about blood draws. Our cheetahs were originally had blood collected in this manner, which was they would go in their transport crates, and this is what they travel in vans. And then we ended up progressing to a more protected contact situation for no other reason other than it's just best practice. And again, this animal has the ability to get up and walk around the table. And then we moved into even more protected contact situation, which allowed us to get a lot bigger blood. And the cat basically lies in between two rooms. We have what we call a car wash apparatus. So the cats and the trainers and everyone can see each other through the mesh. So it's they're very much aware of what's going on. But again, the cat can get up and leave because that barrier doesn't go all the way down. Another cool thing that we've cashed in on is the ability to do imaging. So not only are our cats trained for x-rays, they're also trained for ultrasound. So some of our cats get x-rays in this situation. You can see this specially built platform for the x-ray plate, but we can also do it in a completely protected contact situation, especially for an animal like Moya here, who, you know, his temperament was not completely positive with his veterinary staff. So this way there is much more of a visual barrier between him and the people working with him. Some of the other behaviors that we've been able to train are blood pressures. So we know cheetahs, just like domestic cats, can get kidney disease as they age. So we've trained these cats to accept blood pressure cuffs. If new behaviors are required, we will ask the trainers to train those. So Kwame on the right had some weeping of an eye and needed a full ophthalmic exam. And we were able to bring in a specialist and train Kwame to put his head completely still on a block. So the ophthalmologist could have a look without needing an anesthetic exam. And one of the other things that our cats are able, one of the cool things that our trainers, I should say, are able to do is just what I demonstrated in the last slide. So if there is a requirement or if there is an interesting medical behavior that we would like these trainers to train, they are very, very open to it. So this is a picture of a cheetah called Emmett. Emmett came to us from the wild several years ago. He was a cub that was around 6 days old, had pneumonia and almost died. Well, he recovered. He's become a big, handsome boy, and he's actually trained for voluntary awake plasma draws. We aren't able to collect large volumes of blood from him, but we do collect enough that we can utilize in the medical management of cases of sepsis or any kinds of infections in our other cats. One of the other things that we do is a fair amount of research with our cheetahs. We are not in a breeding situation just because of the nature of how we handle the cats and our space limitations. And so we support breeding and research of our cats in a different way. We collaborate with the Smithsonian's Biology Institute and Dr. Adrian Crozier. And over the last couple of years, we have done artificial inseminations. And this year or should I say in 2019, we did embryo transfers. And one of the reasons the SCBI organization loves working with the Columbus Zoo is because of how well trained these cats are. And the fact that you can give all of their hormone synchronization injections awake, you can collect blood, you could do ultrasounds, you can do any of these medical managements with no to very, very minimal stress compared to other institutions that may have to dart some of these injections. They may have to use anesthesia. So we were really, really lucky and really happy when SCBI wanted to collaborate with us, and we were able to actually have the first ever cubs born from embryo transfer in 2020. So that is a world first for this scientific technique, and we're obviously very proud to have been part of this science. And it's very important to be able to manage these populations sustainably, manage their genetic diversity, and embryo transfer and technologies and assisted reproductive technologies such as this allow us to do that by using sperm, in this case from a cheetah in Texas, at a facility in Texas, and use the oocytes from our female. So being able to bring animals that may not be able to come together or may not have the affinity to breed naturally, we can still kind of improve the genetics of our population under human care by using these technologies. So not only do we support CHEETAH Ambassador Program and being able to tell our story and demonstrate the running skills of these cats and have interactions with people that can really inspire people to care, not only do we support cheetahs through research and science and genetic diversity, but we also support cheetahs through conservation efforts. So we support Dr. Laurie Marker, who is the director of the Cheetah Conservation Fund. We support their work both financially, but also in person. So Avery Young is one of our technicians, and she actually went out to Namibia, which is where CCF is based, and she learned a lot, but also helped a lot and imparted a lot of knowledge. But we also help conservation initiatives and actions through the dissemination of products. So cheetahs are in crisis. They are one of the biggest, I should say, they are one of the most endangered cat species in Africa. There are only almost 7,000 cheetahs left in the wild. And one of the big threats that they face is removal of the cubs and poaching of cubs that are then pushed into the pet trade, often in the Middle East. And Somaliland is one of the hubs where a lot of these transfers of cubs take place. And there have been almost 50 cubs that have been rescued through this channel, and they are now being cared for at a temporary facility in Somaliland. And they were in dire need of treatments such as vaccines, antibiotics, just disposable needles and syringes. And we were really fortunate to be able to help with that by fundraising and sending items out, with a lot of people helping with that project. So the next thing I want to just touch on is the development of our National Giraffe Plasma Bank. When we looked at the data, and this is information from Dr. Lisa Dodone, who is the head vet and conservation head for the Cheyenne Mountain Zoo in Colorado Springs. When she looked at the data of why zoo giraffe died in the past 50 years, you can see a large proportion of that chunk, 26%, was the neonates. So these little babies, these little calves, really form a large part of the mortality. And one of the reasons for this is that these calves are born with limited energy reserves. They are born immunologically naive, and because of the anatomy of the placenta, they don't have immunoglobulins transfer in utero, and they rely on this, this antibody transfer through the milk, through the colostrum, as soon as they're born. And the colostrum is really crucial to their survival. And without that immunoglobulin protection, they are very prone to sepsis and very prone to infections. And they need to have all of these immunoglobulins within the first 18 hours of birth, before all of the gap junctions in the GI tract close and there is no more antibodies transfer into the calf from the dam. So there's a lot of maternal factors and a lot of calf factors that go into why nursing may not happen, and why colostrum may not transfer appropriately, and why calves are born and don't nurse appropriately and get this transfer. And one of the ways that you can correct this is by giving artificial colostrum. So if you know your calf hasn't nursed appropriately, you can give them oral colostrum or even oral plasma. However, if you give plasma orally, it's still not going to cross the intestinal tract and cause, you know, an increase in immunoglobulins. However, if you give it intravenously, obviously you're going to get a rapid boost of not only antibodies, but all of the other colloids and proteins and supportive treatment that these calves need. The other thing is the requirement for pathogen-specific immunity. So although we could give cow plasma to giraffe calves, it's not giraffe plasma. There's always a chance of reaction, but also cows and giraffe are exposed to different pathogens in a zoo situation. And that's one of the reasons that myself and Dr. Dodone from the Cheyenne Mountain Zoo decided to create a plasma bank that was nationally available. So this is one of our donors, one of our biggest donors, called Lance, who has donated almost 30 liters of blood over the last 2 to 3 years. And this was when he was little and he could actually just lower his head and I could stand on the ground. And now, unfortunately, if we try and do this, I have to be on like a giant ladder to reach his neck. But when he was little, he would put his head down and we remove a liter of plasma in around 12 minutes. And again, Lance voluntarily participates in this behavior. He is free to move away. There is nothing stopping him from just backing out of the straps and going into his stall. But he is trained to participate in this behavior, and he enjoys all the crackers and snacks that he gets. So as I mentioned, we have a freezer full of plasma. We have 5 plasma donors right now, which is the most in the US. Although Cheyenne Mountain Zoo and the Columbus Zoo are the primary holders of the plasma bank, other facilities do collect plasma as needed. However, we are willing to send this plasma nationally. We have sent it to 12 different institutions, and 8 of these calves have survived as a direct result of the plasma transfusion. The picture on the left is the Maryland Zoo. The picture on the right is our first ever plasma transfer at the Denver Zoo. And not only is it saving calves, but it really helps us highlight excellent welfare standards that we can demonstrate as a zoological facility, keeping every single calf alive, because again, giraffe are incredibly endangered and are going through an extinction crisis themselves. So as I mentioned, we do plasma collections back of house. We do them in our barn where not many people can see them. In order to increase exposure to not only giraffes in the wild and how endangered they are and why every single calf is important, and not only to draw and highlight how important and what the works, all the cool things and all the work that's going on in zoological facilities to help keep the species alive and help genetic diversity and maintain healthy populations, we actually do it on a public platform. So we will do plasma collections just because the animals like having it done on a public platform, but we'll also do it for special events such as World Giraffe Day. And again, you can see from some of the Facebook comments that, you know, people love seeing you look after your animals and do all of these medical procedures in a completely public forum. And then the last little topic that I'm going to touch on is great ape heart health. It's something that I absolutely love. I love our apes, and the Columbus Zoo is very fortunate and one of the few institutions that has this many species of apes, and we have 3 out of the 4 great ape species. So we have bonobos on the left. I'm sorry, Beanie, stop it. We have bonobos on the left, gorillas, western lowland gorillas, and then orangutans. Great ape heart health has been a growing concern since the Beanie, stop. Great ape heart health has been a growing concern since the 1990s, and you know, at the time it was the SSP, which is the AZA Species Survival Plan Coordinator for a species. The SSP veterinary advisor for gorillas started noticing that a lot of pathology reports were coming back with gorillas dying of heart disease. And it has been found after looking at mortality data that cardiovascular disease is actually a major cause of mortality of all 4 ape species. And the pathologists decided to, obviously the pathologists found that myocardial fibrosis and fibrous deposition in the hearts was one of the major causes of death. But we really wanted to be proactive about it, and we really wanted to figure out what is the true prevalence of mortality, what is the true prevalence of heart disease in animals that are awake, how can we monitor it, how can we research it, how we can figure out the etiology of heart disease, as opposed to just being reactionary and saying, oh, this animal died of heart disease. So this is why the Great Ape Heart Project, which is an international collaboration of a lot of different people, have come together to look after the hearts of all of our apes. So there are a number of organizing partners, but ape institutions around the world can actually submit echoes and echo scans of their Great Ape's heart to this institution, and they will review them and read them by subject matter experts and send you an interpretation completely for free. And it allows you to track the health of your population. So these are just, this is just a video of the top. We have one of our silverbacks. There's our keeper Mandy waving. There's one of our silverbacks who's actually getting set up for an awake heart scan. So this is something that takes a long time to train. But again, as you have probably got the idea that the Columbus Zoo loves to train and loves to do everything awake and voluntarily. And again, this gorilla has the ability to just walk away and not participate, but they have trained him to tolerate this procedure. And on the bottom left, you can see that a bonobo is also getting a heart scan. And something else that we look into in collaboration with these scans is blood pressures, and looking at heart rates of these animals, looking at blood pressures, and that is the little finger cuff on the right hand side. Unfortunately, not all animals will participate in awake scans, and if that is the case, then we actually have to anesthetize them. So we do a fair number of Great Ape anesthetize exams a year, just to make sure that we're getting all the data that we need to keep our apes healthy. I touched on this a little bit earlier, but we do a fair amount of research as zoo veterinarians. So not only do we do primary research, but we also collaborate with a lot of different institutions to either provide samples or to collect samples for them. So again, there's CHEETAH studies on welfare, there's CHEETAH studies on SDMA, which is a marker of kidney function. There's a CHEETAH study on reproduction and looking at anti-malarial hormone levels. So again, we collaborate with a lot of different scientists and a lot of different facilities to make this happen. Something that I don't really talk about during this little presentation is our conservation work. So as well as doing research, we are also very vested and very interested in conservation, and not just for the zoo and for the big picture projects that the zoo will support, but also individually. So I have a real big passion for giraffe and giraffe conservation in the wild, and I was actually able to go to Uganda and help support translocations of giraffe, the endangered giraffe, from one side of the River Nile to another. And as part of that collaboration and translocation, we were able to actually diagnose giraffe skin disease, which is a syndrome that you may or may not have heard about. But again, the Columbus Zoo and my participation was able to publish this paper about the first ever diagnosis of what giraffe skin disease is. In addition to that, we were able to look at venous blood gas and lactate levels of giraffe in their free-ranging country in the wild as part of these translocation events. And, you know, I was responsible for doing the blood gas analysis, but also we did full CBCs and full chemistries in our little mobile lab. So we took all of this equipment from America to Uganda to get this research accomplished. The last thing I want to touch on is how much we rely on other veterinary specialists. So even though zoo medicine is fantastic and we get to work with so many different species and we get to do so many different things as part of our job and as part of our daily routine, One of the things we're extremely thankful for is the ability to work with veterinary specialists that know more about certain subjects than we do. So we work with veterinary dentists, ophthalmologists. There's Dr. Dice from Ohio State for all of our cheetah orthopedic conditions. We work with specialist farriers to make sure that our giraffe feet and hoof feet are well taken care of. And this is a picture of Dr. Niehaus working on one of our giraffes that had a dystocia and needed to have a cesarean section. So again, we're just very fortunate. It's a very collaborative field, and it's just very it's great to have people that are experts in their field willing to help us and willing to donate their time. We're very grateful for that. So with that, I want to say thank you for listening, and if anyone has any questions, I'm more than happy to answer those.
If you guys have questions, you can put them in the chat like last time.
So I know with a lot of domestic cats, like they can get kidney disease, and you mentioned that like cheetahs are common in getting them too.
I'm sorry, I don't, oh, here we go. Okay, I'm sorry, did I miss something?
Yeah, so I know a lot of domestic cats are really prone to getting kidney disease, and you mentioned that like cheetahs are too. Mm-hmm. Is that the same for like the other big cats, like tigers and lions?
Mm-hmm. Yep, it's definitely one of the things that we not expect to see, but are not surprised when we see renal disease in a lot of our big cats. And one of the ways that we've improved our monitoring, and this is not just at the Columbus Zoo, but it's kind of zoo-wide, definitely training is something that has become a big part of how we manage animals in a more positive way, in a more preventative way. And at the Columbus Zoo and Aquarium, all of our big cats are actually trained for voluntary blood collection. And we collect blood from the tail, as you kind of saw in that cheetah video, and they'll get blood work annually, especially when they get into those geriatric years, just so that we can monitor for kidney disease and change the diet if we have to, and provide appropriate care if we need to.
Okay, cool. Thank you.
I have one question. So I know that obviously COVID makes things a little more challenging, and you don't want like a lot of people in your facility, but are there opportunities for undergraduates to either shadow or sort of work with the veterinary, like sort of like shadow what the veterinary team does? Does that make sense?
Yeah, so because of COVID, we actually don't allow anyone that isn't a final year veterinary student right now, but there are shadowing opportunities, but because of, because of the, you can tell it's late in the day, not the desire, because there's a lot of requests for it, we actually limit undergraduate shadows to a day. So it doesn't give you a whole overview of what we do, but it certainly gives you kind of like a snapshot of what a day looks like. So those are definitely available, and you can either email myself or Dr. Randy Youngie, who sorts those out. But right now in the era of COVID, we are definitely not allowing those day shadows and are only restricting access to the final year vet students.
Okay, thank you so much.
Yeah.
There's a question in the chat if you want to answer that one as well.
Okay. In all zoo animals, how often do viral infections occur? So that is a huge topic. It certainly depends on the species. A couple of examples that come to mind are elephants. Both African elephants and Asian elephants, both under human care and also in the wild, can get a virus called elephant endotheliotropic herpes virus. It's a virus that can actually cause fatalities, and it's one of the main drivers of reduced sustainability of elephants under human care. It can cause fatal infections in elephants between 1 and 8 years of age. And in African elephants, the presentation is slightly different, but in the last 12 months, we've seen a lot of animals actually die from it, which previously to that, it was not thought to be an issue. So again, like I said, this virus is found in the native range, it's found in Africa, it's found in all of the home range countries of Asian elephants, but it's something that we are all working very strongly towards to either find a vaccine for this viral infection and obviously find novel therapies. Another big class of virally affected animals are our cheetahs. So they do get feline herpes virus, and it's manifested in a very similar way as with domestic cats, but we have a cheetah right now that actually got viral encephalitis, potentially from herpes virus exposure. So it definitely depends on the group of animals, and it depends on the type of virus, but a lot of the domestic animal viruses that you are concerned about, such as canine distemper, are also viruses that we are concerned about in our non-domestic animals, and if appropriate, we vaccinate them. So for example, we vaccinate all our cheetahs for canine distemper. We whatever we can do, we will do. So we, again, vaccinate our giraffe for rotavirus and coronavirus, which are viruses that are often found in domestic cattle and cause disease in calves. But we do also see fatalities in giraffe calves from this virus. So anything that we have found data to support, we will definitely try and prevent. So I don't know if that really answers your question, but there's a lot of examples.
It does, thank you.
How do you go about working with species you're unfamiliar with, or when there isn't a lot of information? Oh my gosh, every single day. So we like to say that we're the jack of all trades, but the master of none. And one of the things that I think every zoo vet is familiar with is being creative and saying, oh my God, what do I do, almost on a daily basis. So there's always a situation every day that you've either never experienced or don't have anyone else that have experienced it. But one of the strong suits of zoo veterinarians is how collaborative we generally end up becoming, and that big group of people that you can talk to. So we are a very, very tight-knit community as zoo veterinarians. So if you don't know something, we find it very easy to pick up the phone and reach out to all of our veterinary colleagues that can give us information. Often emergencies happen and you end up troubleshooting, and that's when you go back to those first principles I talked about. You go back to figuring out, using models. So if you have a sick giraffe, we will model it on a cow, or if you have a sick zebra, you're modeling it on information that you know in a domestic. One of the things that we do a lot is a lot of that. So using poultry medicine as a basis of figuring out what's wrong with your scarlet ibis that is doing something funny. So there's ways we get around it, but it is certainly something that we face every day, not having all of that information right at your fingertips. Do you field work on animals in the wild? Yes. So I was able to go to Uganda and do giraffe translocations. I've worked with elephants in Sri Lanka. When COVID stops happening, I will be back in the field in Niger and Uganda doing more giraffe work. Dr. Randy Youngie, who is our VP of Animal Health, he actually has spent time working in Madagascar over the last 20 years and is the director of the Persimmon Biomedical Research Project. So he has a lot of field work experience. Our staff veterinarian, Katie Seeley, has also been to Madagascar. All of our technicians have done some kind of project in the field. So again, financial situations are very different in this year in COVID, but the zoo has at least supported us with time, if not financially, to help with a lot of conservation projects. In your opinion, what personality is best suited for a zoo veterinarian? Oh, I would say someone that's flexible, creative, definitely confident without being a know-it-all. There are a lot of times where you do have to make emergency decisions about a lot of things that you might not be aware of or know. So I think you just have to be adaptable and aware of those limitations, and be very hardworking. This is definitely not a 9-to-5 profession. I would say many veterinarians don't have a 9-to-5 job, but a lot of domestic animal veterinarians do. And unfortunately in zoo medicine, we don't have that luxury. There is a veterinarian on site every single day of the year, including Thanksgiving and Christmas. We are always on call. We have a residency training project right now. We have a resident in training right now. And when the resident is on call, we are their backups on call. So you're very committed to, you have to be very committed to the profession. You have to be very committed to your institution to do well. Here we go. What's this one? Are cheetahs the only species that have to go through in vitro fertilization at the zoo, or do you utilize this procedure for the majority of species? Whatever species that we can put into natural breeding situations, we will, because obviously that is the most ideal. We don't want to do general anesthetics for breeding, and we want to do what's the safest for the animal. However, we do assisted reproductive technologies on animals that either won't breed naturally because of the availability of a male to female, or they won't breed naturally because of incompatibility. And I'm talking more from a temperament behavioral point of view. So we have done AIs on tigers, we've done AIs on elephants. We've done AIs on small ruminant species. We've done a lot of artificial insemination projects in the wilds. And again, those are from a research perspective, trying to pin down this technology that can then be applied to other institutions, or can then be applied to species in the native range. So again, trying to increase numbers as well as genetic diversity, both are very important. What would you say that it is common for zoo veterinarians to travel and get opportunities to work with animals? Or these, okay, or are these opportunities harder to come by? 100% depends on your passion, your interest, and your zoological facility's commitment to that. Certainly when I went to Uganda to do the giraffe field work, the zoo supported me with time, but not financially. I had to get a grant to support that project. But we're still very fortunate at the Columbus Zoo that they're supporting us with time and allow us to go to do these projects. A lot of zoological facilities may not allow you to do that. You know, we're very much aware that our daily focus is the collection animals and making sure all of our animals are well taken care of. But something that Dr. Youngie taught me is, you know, you have to have that passion. You have to kind of keep that fire alive. Ultimately, I think everyone kind of goes into zoo medicine because they saw themselves working in Africa on conservation projects, or they saw themselves working in the field, and you know that didn't pan out, and they're in zoo medicine. And I can't say that is 100% true for me, but I definitely want to be doing conservation work in my daily life, and I'm very fortunate that the Columbus Zoo at least supports that.
I have a question real quick. Can you hear me?
Yes.
Would you say that zoo medicine positions are more competitive than other veterinary medicine positions?
That's a tough one for me to answer, because in the US, I've never really had the need to apply for other positions. My experience in the UK, and this is obviously 15 years ago, was that it was pretty not competitive, if that makes sense. There were a lot of opportunities available in companion animal practice. I will say the zoo field in general is incredibly competitive. There are only, per year, there are only 8 to 9 residencies that open a position, and most zoo jobs right now require you to be residency trained, or at least eligible to sit the board exam, which requires you to, well, not necessarily requires, there are alternative pathways, but usually requires you to have been through a residency program. So I would say that it is competitive. I don't think it's becoming more competitive, but it certainly is difficult to get a job. I think you have to be very persistent, and you certainly have to be prepared to go through that residency route to get a well-paid job in a high-profile zoological facility.
I have a question real quick. I've gotten this question from some first and second years who decide to go pre-vet, and you are way more qualified to answer it than I am. They asked me, you know, when you become a veterinarian, how do you balance that with your family life, whether that's, you know, with just like your family or having kids or etc., because it's such a demanding job. But you know, people who have a passion for it obviously are okay with that, but how exactly do you balance that, especially for, you know, being companion animal and things like that, or for people who have a more of a geared interest towards the non-typical like 9 to 5 veterinary fields, if that makes sense?
Yes. It's tough. And I will say I am 37 years old and I still struggle with work-life balance 100%. An example of that was I was talking to a keeper today, and we may be moving a tiger and they need a blood sample off that tiger, and we only started training the tiger today, and the tiger may be leaving as soon as next week. And they were like, oh, you know, we really don't have a lot of time. And I stupidly volunteered to go in on my weekends to train this tiger and get blood from this tiger, because you just can't help it. You want to do what's best for the animal, and you're like, oh, I can totally come in on Sunday. That's not a big deal. So I still struggle with saying no. I still struggle with, you know, being able to kind of shut my brain off, especially in the zoo field when you are there 24 hours a day. Keepers are there 24 hours a day. There's always someone that needs you. There's always a question that needs to be answered. And unfortunately, even though it's probably not a hugely positive trait, it's one of the things that I pride myself on the most, is being available to my animals and being available to my keeper staff and being available. And initially it was tough, but then your kind of life adjusts around it. And I don't know if you can see all the crap in the background, but I have a 10-month-old baby, and it's been a tough adjustment, being able to say, okay, I need to leave at 4 to pick my kid up. You know, I can't come in on blah, 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 because I got my kid. So it is tough, but it's 100% manageable. And if I can do it with massive control issues and OCD, then I think anyone can do it. But it just takes perseverance, and it takes commitment to know what's important and to be able to take that mental break. We all know that mental health issues in zoo veterinarians is, you know, something that we all have to be aware of. And one of the things that I think, this is a really rambly answer, I'm sorry, but one of the things that I think has really helped me is having that passion. So being able to wake up every morning and not go, oh my God, I hate going to work. Like being able to go into work every morning, and no matter how hard that day has been, or no matter how hard that day you're expecting it to be, still wanting to go in and still having that passion and still having that joy. So I think that makes those personal sacrifices a little easier to deal with, but I think it's something that you just have to be aware of and try and balance as much as you can.
Does anyone else have any questions? Okay, well, if that's all, then I don't want to keep you for too long, Dr. Bapodra, but thank you so much for coming. It was very interesting, and everything was just really cool to hear about.